I was very scared, very scared when it was gonna happen. And I just cried at my bedside and told the Lord, "It's in your hands. You tell me which way I'm gonna go."
Well, I remember before I went in because when they first came to pick me up, it was like 7 o'clock in the morning. And when they came to pick me up, they said, "Well, we'll see you later." I said, "I hope so." It's just like I told her, I said, "I hope so." And then they took me on downstairs. And all I remember once I was down there was how they was using that. They was prepping you, putting the IV and all that stuff in so you can get the anesthesia and all that. They told me to count from 100 backwards. And next thing I know, I don't even think I got to 80. And I was out. And that's all I remember.
And when I came out of surgery, I thought I was in recovery for 3 hours. The wife told me I was in recovery for a week. I was out for a week. She was there the whole time, never left my side.
And when I woke up, it was hurting. I think I stayed in ICU for like 4 days. And after that fourth day, they put me up on Fundrin 11. And I stayed at Fundrin 11 for a month. And after that month, during one of those days they bring you home, kneel to make sure you okay with coming home and knowing how to use your equipment and stuff. And then after that, the next day they release me. And that's that.
I was unusual in that it took me so long to recover. I understand that most people would go through this and get to the point to where they would be at least out of the hospital in a month to a month and a half. And I spent at least 2.5 months in the hospital. I had a lot of complications. I had an infection that kept coming back that would not go away. That kept me in the hospital. They could not even allow her into my room without gowning up and everything.
The process of recovery was, I would say it was pretty bad for me anyway. For one thing, I didn't want to be in the hospital. And I'm sure that's kind of what everyone feels. The other thing, I didn't really know I knew what it was, but I really didn't. And I didn't know how long I was going to have it. And of course, no one could tell me, you're going to have it for a week or 3 years or whatever. And so, I mean, I think it was very rough. They tried to get me to walk. And the first time I got up out of bed to walk, and that was in the ICU, I think. I couldn't walk. I couldn't stand up. I couldn't hold my head up. And then the second day they got me out there, and I took about 10 kind of steps to the doorway and back, and they thought, "Oh, wonderful, wonderful." And so it just kind of progressed and progressed. And I basically had to learn how to walk again.
I did some cardiac rehab after, and that helped. I did that at just my local hospital in Fairfield, and that lasted a couple of months, well, maybe 3. And then they had a wellness program, so I just stayed going to there, and did it right there at the hospital.
Then you start going to different progressions in the hospital. It was like I was doing a countdown of, oh, we got another tube out of me. I had to have a trach in me. That was driving me crazy because I couldn't talk. So you go through various steps like that. And like I said, I go through a countdown of, okay, we got the tube that I was being fed through. The trach comes out. This comes out. This comes out. I had a permanent IV, I forget what they call them, in me. That finally came out. And almost each step finally says, I can get up and walk to the bathroom. I was so happy to do that one simple thing. And then, of course, the next step is getting out of the hospital. getting down to rehab. I was still in the hospital, but the rehab itself, those people are wonderful people downstairs.
And I think I was pretty rough on my wife, and I was short with them, and the nurses too, and the doctors. I think I was pretty short.